Heather McRae is a 33-year-old female seen in clinic today for a headache that has been worsening over the last 10 hours. It started this morning with no triggering event. She reports the pain started behind her right eye as a sharp pain and then radiated globally and now a throbbing pain. She rates it as a severity of 8 out of 10 on the pain scale. It is worsened by loud noises, bright lights, and movement. It is better when resting in a dark room um, with a one-time dose of 1,000 milligrams of Tylenol and 200 milligrams of ibuprofen. She attempted to drink caffeine this morning with no relief. She reports associated symptoms of nausea with decreased appetite and uh, fatigue with inability to rest, phonophobia, but denies vomiting, visual changes, uh, um, stiff neck, and fever and chills. She reports having a history of headache occurring once to twice a month since adolescence, but none have been this long or been this intense, and usually are relieved by medication and rest. She reports needing to find alternative childcare, and this has affected her ability to go about her day. On past medical history, she does not have never been diagnosed with any significant medical issues. She has this history of headache as well as seasonal allergies. She reports a history of illicit drug use, cocaine and mushrooms over 15 years ago, and does report use of ETOH, usually one glass of wine every 6 months, but did drink 2 glasses of wine last night with friends. She has a Mirena IUD, otherwise does not use any other prescription medications. On her physical examination, her vital signs are stable, and she had her neurological exam was unremarkable, besides some mild photophobia when assessing cranial nerves. Because of these physical findings and past medical history, my working diagnosis is migraine without aura. My differential would be migraine with aura, tension headaches, drug withdrawal, and sinusitis, with my rule out being subarachnoid bleeding. For laboratory diagnostic, I don't believe anything further is necessary based on her HPI and her uh, physical examination. However, we can provide a dipstick pregnancy test since the patient no longer has periods related to her Mirena IUD. For treatment, I would give her 6 milligrams of sub-Q sumatriptan here in the clinic and watch for medication reaction and improvement in her clinical finding. And then, as long as she improves clinically, we can send her out with a prescription of 25 milligrams of sumatriptan for headache relief that she can take every 2 hours, up to 200 milligrams, and then educate her on migraine triggers, migraine management, and how to use a headache diary, with follow-up appointment with us in 1 month, and we'll follow up with her over the telephone tomorrow to see how she's doing and relay headache warnings, red flags, such as thunderclap headache coming on in less than 1 minute, worst headache of her life, any fever, chills, nausea, vomiting, any worsening headache that's not relieved by medication, any visual changes, any changes in her neurological status, and any numbness, tingling, changes in sensation.